Research Translation Symposium, and we have been very lucky to get Kelso, who is the CEO of the NHMRC, and we thought we'd just ask you about a quick reflection on what your take-home message was from the conference around Indigenous knowledge translation.
I think the most important message for me is the centrality of community engagement. It's something I knew in a hypothetical way beforehand, and we try to foster and encourage it through our funding policies. But to see how that's actually expressed in the way people do work and how important it is for the design of projects. The projects need to come from the community. That's what I really understand from what's been discussed over the last few days. Come from the community, be co-designed with communities, and then ultimately communities will be the people who implement the outcomes of research. It's just essential. And I think that there's much to learn for all sorts of health systems. And so as I listened to the talks through the meeting, I often thought, why don't we have this conversation about all health systems? We're having it clearly about Indigenous health research. But as a non-Indigenous user of the health system, I want the health care that I receive also to be community focused, family focused. I think we have a lot to learn from the thinking of Indigenous health research today and how that can lead to better health outcomes in the long term.
That's fantastic. I mean, we talk about consumer-centred healthcare, so maybe we need to translate that into, as you said, consumer, community-centred research in all aspects, not just Indigenous aspects. And I guess, embodying that and seeing that as we've had here the last couple of days is such a privilege. So thank you for allowing Croaky to cover this and for sharing those insights, and we look forward to working with you in the future.
It's my pleasure, thank you.
Short and sweet.